ก็อาจารย์นภัสค่ะเห็นจัดฟันเขามีแบบว่าพื้นหลังเป็นคลินิกบ้างแล้วก็
โอเค
มาต่อบ้าง
อันนี้ก็จะเป็นป้ายหน้าคลินิกที่อยู่ที่ชั้น11ตึกบรมนาถนะคะ
ค่ะ
นั้นเราเริ่มเลยมีหลักสูตรอะไรบ้าง
นะคะ
เชิญครับ
ค่ะของภาควิชารังสีวิทยานะคะขอแชร์สักครู่หนึ่งนะคะ Okay, so I will continue my presentation in English. Okay, since there are some international candidates here. Our department is like a small department called the Department of Radiology. We have we have 9 staff, and this person is the head of our department, Dr. Polakrit. And this is me. I'm just a new staff here in the department. And this person is he is studying abroad for the PhD degree. And we also have a special instructors from other departments or the other institutes outside of Chulalongkorn University, especially for Dr. Panida, who is a radiologist from Faculty of Medicine, Chulalongkorn University, and she gave us a lot of valuable advice in according to ultrasonography, which for dentists we may not be much familiar with. And our department's curriculum consists of 3 different courses, 1 2-year course and 2 3-year courses. The 2-year course is the Master of Science program in Oral and Maxillofacial Radiology, and the 3-year courses have a residency training program in oral diagnostic science and a higher graduate diploma in clinical science, which is an international program. For the detail of each program and the requirement or the score, the GPA, you have to enroll in our courses. You can look for the detail in website of our faculty. And so today I will show you the facilities we have in our department, especially ones for the advanced techniques like a Cbct or the ultrasound machine. We have 2 Cbct machines and several 3-in-1 Cbct machines in our department, and also 1 ultrasound machine located in a radiology clinic at the first floor of Samdetya building. This is the newest, the latest Cbct machine from J Morita company. The advantage of this model is it can provide a lot of like a very broad and wide field of view, so you can cover from almost like the top of your head to below your chin, which is very profitable, very beneficial for the orthodontic surgery. And we can this machine can provide a very small field of view, which is suitable for like locating the missed canal or the root fracture in endodontics field. And this is the second CBCT scan. It's like the older model, also from the J Morita company. And this is an example of the 3-in-1 3D CBCT machine. And this is the software. It's also the latest version of the software we have to. It's called the on-demand software. The software can do a lot of things in radiology, like distance measuring, viewing CBCT in many modes, like the MIP, the MPR, or the 3D surface rendering. Or in this picture, you can see that it can assess the volume of the airway. So can help a lot with the various field of research. And also this screen is a medical grade display, which is suitable for viewing the radiograph, which we want a lot of details, and this monitor, this display can provide us that information and will make the diagnostic procedure like more precise. And this is Dr. Panida that I mentioned at the beginning of the presentation. She is from Faculty of Medicine and she has an expertise in ultrasonography. So she comes to our department for teaching and giving the advice. And this woman here is our residence student. Okay, may I get it better? Okay. This lady here is our student in the residency training program, and she conducts research on carotid artery assessment using the ultrasound machine. And she has the opportunity to present one case report at the conference in Khon Kaen province, Thailand. This report has collaboration with one staff at faculty at Department of Pathology too. And this is our undergraduate student. They presented their research in the International Scientific Conference of Dental Faculty Consortium of Thailand, and they received an award. And this person is a student in residency training program from a Department of Dental Surgery, and two of our staff were his advisors and help provide the views or advices from the radiologist's point of view. And during the COVID-19 pandemic, this is the picture of the staff, and this is me. And we are doing the online examination for the undergraduate student. And one of our staff is invited to speak in the program on one of our national TV channel about the new measure about the dental treatment during the COVID-19 era. And another two of our staff has an opportunity to speak in the annual meetings of the Dental Association of Thailand. This is the one from I think it's 2019, before the COVID. So the meeting can held on site, but for the next year the meeting is online, but our staff are invited again to speak about the panoramic topics. Okay, and we also have a good relationship with the foreign researchers too, and back in the time that we can travel more freely, we go abroad time to time to present our studies and findings and make the communication and collaboration. Yeah, and thank you. This is all for my presentation, and I hope that I will see you in next year.
Okay, thank you very much for your valuable data. And we know each other well because we have a many collaborative research with radiologists. ขอบคุณมากนะคะอาจารย์ณภัสค่ะก็รู้สึกว่ายังเปิดรับสมัครอยู่นะคะ1 กุมภาพันธ์ถึง31 มีนาคมค่ะใครสนใจก็เรียนเชิญหลักสูตรนี้ได้เลยนะคะค่ะก็ขอบคุณค่ะสำหรับการที่สับข้อมูลนะคะ